My name is Barbra Kenyon, and I'm Amelia Crowfoot's mom. So Amelia came down with mono in May of 2018. After having mono, she was complaining of a lot of aches and pains. She said that her hip hurt so bad that she couldn't concentrate and she felt like she was going to throw up. And I said, well, I'll come get you. And when I picked her up from school, she was pale and she was shaking and she looked like she was going into shock. She just started going downhill really quickly. More aches and pains and more aches and pains. And at first I thought it was the after effects of mono, but she just kept getting worse. So we started trying to make appointments with doctors, but of course everybody was 3 months out. So we got an appointment with an orthopedic specialist. And by the time we got her to him, she was hardly able to walk. We barely got her into the clinic, and he said, I don't know what's wrong with her, but something's really wrong with her and you're gonna have to figure it out. And he said, my best guess is she has Ehlers-Danlos or she has Lyme disease. And if it's Lyme disease, I don't even know what to tell you. He said, tests aren't good at finding it, we're not good at finding it, we're not good at knowing what to do once it's found. At that point, getting her up and trying to get her to go to the bathroom, she'd be shaking and on the verge of vomiting when I got her back in bed because she was in so much pain. And they were giving her narcotics and everything, and it wouldn't cut the pain. Nothing even touched it. Amelia's 17 and I'm her caregiver. I've been here with her the whole time. I mean, it can be exhausting. I come here for sometimes 6 hours a day, and at the end of that time, I'm usually pretty exhausted because it's a lot of sitting and a lot of rubbing feet and a lot of rubbing heads and a lot of getting tea and things like that. In my world, like the world stops spinning and everybody moves heaven and earth to help a 17-year-old kid. But it seemed like in the medical world, everybody was like, we can get her in 3 months. And I couldn't believe it. Doug, my husband, started researching places, and he said, I feel like this is Lyme. It's got to be infectious. Nothing else makes sense. And he found Envita. I got a hold of Samantha and I told her what was going on. And Samantha was the first person I talked to that seemed to care. So when I told her what was happening, she said we could probably get her in 2 weeks. And I started crying and I said, I feel like coming and just sitting in your waiting room until you see us. If you think you could help her, please. And she said, hold on. And she called me back in 2 hours. She said, I can get you an appointment in 2 days. And it was the first people, including ER docs and everyone, it was the first experience I had that somebody cared that my 17-year-old could no longer walk. So the amazing part is we get her here, and it's me and a friend, and we literally, each of us on either side of her, and she walks in and she can barely walk. She's shaking, she's pale, she can barely move. And we saw the doctor and he said she has Lyme. And I had asked, do you think you could stabilize her? If we come for a week, can you stabilize her? And they were like, can you give us a little longer than a week? So I took her in, they gave her some treatment that day. In 10 days, she walked out of here with a hop in her step, flew home, went out with friends that weekend, and it was incredible. Before coming here, I worked really hard to research this place, and I had a lot of skepticism. But through my research and through everything I've read, everything that they've done checks out, and her healing has been amazing. And if that's the one thing that I could convey is, regardless of skepticism, come, because I really believe it saved Amelia's life. I really believe that she would not have had a normal life if we wouldn't have come here.